I was 15 years old when I was diagnosed with Crohn's disease. For over a year leading up to my diagnosis, I had suffered severe abdominal pain, joint pain, psoriasis, and I was anemic. As daunting as a Crohn's disease diagnosis felt at 15, I was thankful to finally have some answers so that my pain could begin to be treated properly. Do you recognize any of these 4 people? Do you know what they all have in common? They all have been diagnosed with Crohn's disease. Today I'll be talking to you about Crohn's disease. First, I will explain what it is, how to diagnose it, and who is at risk or affected. Second, I will explain what the symptoms are and other areas of the body that are affected. Third, I will explain different treatment possibilities and if there are any known cures. Crohn's disease is an inflammatory disease that affects every part of your life. Now I will begin with explaining what Crohn's disease is. Crohn's disease is an autoimmune disease, meaning that your immune system attacks healthy tissue thinking it is a foreign object in your body. Crohn's disease is an inflammatory bowel disease. It is commonly relapsing, where patients experience periods of remission or temporary recovery, followed by flare-ups, where the disease is active and the symptoms are active. Crohn's disease can affect anywhere in the digestive tract, from the mouth all the way to the anal region. The cause of Crohn's disease is unknown. It arises spontaneously and can occur at any age, but most commonly in younger patients. If you have a family history of Crohn's disease, you are at a higher risk of developing the disease. According to Professor Daniel Baumgart, Chief of the Department of Gastroenterology, Hepatology, Infectious Disease, and Rheumatology at Ernst von Bergmann Hospital, early tobacco use significantly increases your risk of developing the disease. It is estimated that out of 100,000 adults, 189 of them will have Crohn's disease. Last year, there were 4,675 students enrolled at North Seattle College. That means that around 9 of your fellow classmates and students could have Crohn's disease. Now that we've discussed a little bit more about what Crohn's disease is, I would like to move on to the symptoms. Some symptoms vary depending on where at the digestive tract the disease is located. Those diagnosed with Crohn's disease usually suffer from malabsorption, which is a digestive disorder that prevents your body from absorbing nutrients effectively. Extreme weight loss due to malabsorption, weight gain due to symptoms of inflammation, and abdominal pain due to inflammation. The digestive tract is the main area affected, but other parts of the body can be affected as well, such as the eyes, skin, joints, kidneys, and liver. There's an increased risk of cancer and osteoporosis due to a compromised immune system and is a side effect of some of the medication used to treat Crohn's disease. Fertility is lower in patients with active Crohn's disease. Rahul Kala notes that unfavorable pregnancy outcomes can come with active Crohn's disease. Therefore, the disease should be heavily monitored in pregnancy, and any flare-ups should be treated aggressively in pregnancy. Rahul Kala earned his PhD in inflammatory bowel disease in 2016. He is presently a consultant gastroenterologist at Royal Infirmary of Edinburgh, the oldest voluntary hospital in Scotland, and is a research clinician in the field of inflammatory bowel disease. Now that we've discovered a little bit about what it's like living with Crohn's disease, let's move on to the possible treatment. Management or treatment depends on the severity of symptoms and the advancement of the disease. Corticosteroids, which are a steroid medication used to treat inflammation, have been effective at inducing remission, but should not be used long-term as there are serious side effects that go along with long-term steroid use. Biological drugs, which are a class of medication produced from organic life rather than being synthetic, have been used to maintain remission and are an option for long-term. I, for example, am on the medication Stelara and have been for over 7 years now. Other examples of biological drugs include Humira, Remicade, and Entyvio. When these options fail, surgery is most often the answer. Common surgeries include removal of fistulas, which is a abnormal connection between 2 organs that should not be connected. The surgery to fix this would be just to remove that connection or that tunnel. Another common surgery is intestinal resection, which is the removal of the diseased area and putting the two healthy ends back, connecting them back together. I've had 2 of those intestinal resection surgeries. There is no cure for Crohn's disease. The goal is to stay in remission. Regular checkups and monitoring the disease are essential to ensure the longest remission lengths possible. I hope you all have a little more knowledge of Crohn's disease now. So with that, I would like to review some main points. Crohn's disease is an autoimmune disease that causes chronic inflammation anywhere throughout the digestive tract. It can be difficult to diagnose, but most often diagnosed at a young age. There are a vast variety of possible symptoms. Crohn's disease does not only affect your digestive tract, but many areas of the body as well. There is no cure for Crohn's disease. There are, however, possible treatment plans to reach and maintain remission. Crohn's disease is an inflammatory disease that affects every part of your life. After I was diagnosed with Crohn's disease, I was scared, angry, and bitter that I had to live with this lifelong disease. Now, with all that I've gone through, that anger and bitterness has turned into thankfulness and strength. Thankful to be here and to have the strength to keep fighting.